Now, without further ado, I'll hand it over to Tom.
Thanks, Kerry. I'll share my screen and just make sure that everyone can see it before I start going. Does that look okay?
Yes, it looks perfect.
Let me just check. Okay, yeah, we can go through it. All right, well, thank you very much, and thanks to the Thoroughbred Breeders Association of Victoria. So yeah, originally from Australia, spent a few years overseas. After Georgia, I went to Colorado, and then I came back to Avenel August last year to kind of set some roots up and work alongside one of my mentors, Angus Adkins. And it's great to be back. And so I thought I'd start the presentation with a little picture of our facility on a lovely sunrise. This was last week after we had a little bit of rain, and it was just a beautiful morning. So I'm not normally a photographer, but I decided to take a photo. And if you haven't been up around this way and seen the clinic, any one of you is more than welcome to come and say hi. And it would be a pleasure to show you through our facilities. So I think I've got about 45 minutes or so to talk about angular limb deformities. It's not a huge amount of time, but hopefully it's enough to get some important messages from the talk. And so when we think about angular limb deformities, refer to them as ALDs. Essentially, we're talking about bent legs. Now, in this particular photo, it's pretty easy to see that the legs are bent when you're standing in front of the foal. And I guess one important point is that angular limb deformities, they're different from contractural or flexural limb deformities. And the key difference is that with an angular limb deformity, you really can only properly assess it and observe it when you're standing in front of the foal. Whereas if you have a flexural or a contractural limb deformity, you need to stand from the side. And that's how you would see a flexural or contractural limb deformity. And so this talk, we're really focusing on angular limb deformities. So those deformities that you can see from the front or the back of the foal, as opposed to a flexural limb deformity where you can view from standing at the side of the foal. And so they commonly occur in either the carpus, the fetlocks, or the hocks. The most common location that they occur is at the carpi, followed closely by the fetlocks, and then last but not least is the hocks. The hocks don't tend to occur as readily as angular limb deformities that occur at the carpus or the fetlocks. And so there are a couple important terms that we use. And so I'm going to go through those now to try and make them as clear as possible. And so if we're thinking about the carpus, so also known as the knee, we have two different deformities, really, at the very essence of it. We have what's called a valgus, and we have what's called a varus. Now, one of the key things is that if we're standing in front of the foal and we're looking to see whether or not there's a carpal angular limb deformity, what you want to do is you want to start drawing lines in your head. And you want to look at where the line below the carpus is going. Now, hopefully you can see my mouse, is that we'll draw a line down the front of the radius, so above the carpus, and then we would draw a line down below the carpus, and we would look at which way the line below the joint is going. Now, if it's going outwards or lateral, we would refer to that as a carpal valgus. And the image on the right shows that if we draw those lines and the line goes inwards, we refer to that as a carpal varus. Now, one way that I have remembered this, probably for a long time, is that the word valgus has an L in it, and L stands for lateral. So with valgus, we're looking for a lateral deviation of the leg below the joint that we're interested in looking at. And so if we think about the fetlock is very similar. So we're standing in front of the foal. We've gone, okay, these legs aren't perfectly straight. There's something going on. You start drawing these imaginary lines in your head. And so the image on the left shows a fetlock varus. And a fetlock varus is also pretty similar to being pigeon-toed. So where the line below the joint of interest is going inwards, that would be a fetlock varus. Now, a fetlock valgus is the exact opposite, where if we start to draw those lines in our head, we can see that this image on the right, this foal has a left front fetlock valgus, where that line is going lateral. And so one of the key things is actually standing in the correct location. And so what I mean by that is if we're suspicious of an angular limb deformity, or we want to assess the foal for an angular limb deformity, it's all very well to stand directly in front of the foal, but the real and the true place that you want to stand is actually perpendicular to the joint of interest. And so this is an image taken from a textbook that I've spent many hours reading. And the image on the left shows a set of footprints, which is standing directly perpendicular to the carpus. Now, the important thing about that is that when you're standing perpendicular to the joint of interest, it allows you to assess what the bone below that is doing. And so the image on the left shows a carpus that is pointed out a little bit, and then the bone below that carpus is still pointed out. Now, that would be a fairly unique case where that foal would have what's called outward rotation of the leg. Now, if we look at the foal on the right, you can still see that set of footprints standing perpendicular to the carpus. So they're standing in the right location. And then you can see that actually the toe is going inwards. And so that foal would have a varus deformity of the carpus. Now, static exam is really important. And so we're looking at how the foal is standing still, preferably distributing weight evenly between the four legs. And so the image on the left is okay, but it's not great. You know, the foal's not super square. But what we're looking at is we're looking at what these bones are doing. And so when we start to draw lines, imaginary lines, we can see that if we draw a line down the front of the cannon bone, and then below the fetlock joint, we can start to see that that line below the joint of interest is going inwards a little bit. And so this, I'm not sure it's necessarily a foal, it's probably a weanling, this one, has a mild fetlock varus because it's slightly pigeon-toed in that right front. And so the image on the right shows a pretty obvious angular limb deformity. You can see that this foal's not straight. And so when you start to draw those lines, you can see that if we draw a line from the elbow down to the carpus, and then from the carpus down through that cannon bone, that it's going outwards. And it's the exact same for that left front. And so that foal on the right would have a bilateral carpal valgus because we have a lateral deviation of the leg below the carpus. Now, probably one of the most important parts of doing an exam is a dynamic exam. So it's all very well to look at what this foal is doing at a stationary aspect, but it's really important to watch what's happening as it's actually moving. And so this video has been slowed down. It's a little bit blurry from a distance, but we're looking at a few things. We're looking at how the foal is landing, how it's breaking over, and then how it carries the leg through the air. And so as we watch this foal coming towards us, we can start to appreciate that in that left front leg, it has a mild varus deviation. And so if we're to draw those lines down the cannon bone and then from the fetlock down to the toe, you can see as this foal starts to move around towards us, it'll have a slight inward deviation of that left front leg. And I'm pretty sure it ends up facing us nice and straight where you can see that. You can appreciate it there as it's standing, how it carries it. And so you can see that if we're to draw a line down the cannon bone and then from the fetlock down, that line is going to go inwards. And so it's really important doing a dynamic exam where you're watching that foal not only walk away from you, but probably more importantly, walk towards you as well. And then sometimes we get these angular limb deformities where we're not quite sure, or we want to objectively assess the angle of deviation. And the way that we would do that is through x-rays. And so x-rays allow us to measure the angle of deviation. They allow us to assess bone structure around the growth plate as well, and give an objective opinion or analysis on the angular limb deviation. And so you can also draw lines on x-rays, and you can see that the x-ray on the left has a bilateral carpal valgus deviation, and then there's two white arrows pointing to areas of black in the radius. And so it's not uncommon, particularly with moderate angular limb deviations, to have some degree of bone change. And in this particular case, the way that the foal is bearing weight, there's a lot of strain on the inside of that bone. And so you can get changes to that bone, which is only really apparent on x-rays. And similarly, for fetlocks, you can take x-rays of fetlocks. Now, the key thing is that the x-ray needs to be as perfectly DP as possible, because if it isn't, you don't get an accurate angle of the angular limb deviation. And again, you can start to draw those lines. And so I apologize for this meme, probably a little bit corny, but when I was thinking about what causes angular limb deviations, the first thing that came to my mind was that sometimes they're born with it. I remember when I was really young growing up, you had that TV commercial about, maybe she's born with it, maybe it's Maybelline. And I came across this horse meme, and I thought it was just kind of quirky. So there's really two classifications, either congenital, so the foal is born with it, or acquired, i.e. the foal is normal at birth, and then for whatever reason, it develops an angular limb deformity at some point after it's born. And so one of the first reasons to explain how a foal could have it at birth is through abnormal joint development. And really the only way to assess that is through x-rays. And so you can see here that on the left, we have x-rays of a carpus from the front and a hock from the side. And the bones of those joints are normal. They're good. And so the importance of that is that those bones provide good stability to the joint, which is important for the foal's ambulation, weight bearing, load sharing, and typically if the bones and the joints are okay, and they don't necessarily have an angular limb deformity that you would need to worry about straight away. Now, the image on the right shows x-rays of a carpus from the front and a hock from the side. And you can start to see that they just don't quite look like the x-rays on the left. You have these sort of rounded bones making up the carpus and kind of smaller bones making up the hock. And so if you have incomplete ossification or abnormal joint development, as you can imagine, you don't have the support that you need for that foal to be able to take weight and keep the leg where it needs to be. And so that can predispose to an angular limb deformity. And in really marked cases, you can see here that the x-ray on the far left is showing a hock from the side point of view, is that we really have complete loss of any bony structure of that hock. And also for the x-ray second from the far right, you can see that when that foal is x-rayed from front on, there are pretty much no bones in the carpus. And so the way that bones develop is they originally develop from cartilage. And so in these particular cases, there's going to be cartilage, but it's going to be really, really soft. And it can predispose to an angular limb deformity. And so that's one of the first things. Now, some things that might make you think of that is if you have a premature foal, I would say it's pretty important to recommend x-rays of the carpi and the hocks if you have a foal that's born premature, or also dysmature, which is, i.e. it's at the appropriate gestational length, but for whatever reason, it hasn't matured to adapt to life straight away. And sometimes they undergo what's called abnormal intrauterine development. So if they experience forces in utero that may put some forces on the bones as they're developing, sometimes they can be born with an angular limb deformity. And so the images here are x-rays of two fetlocks on the far left and then the middle, and then of a cannon bone on the far right. And you can see that the images on the far left and the middle just have mild angular limb deformities. That's not a worry. But the x-ray on the far right, you can appreciate that there's a substantial change to the architecture of the cannon bone in the hind leg of that foal. And so x-rays can be particularly useful, particularly if examination of the foal is abnormal or suggestive of, hey, there's kind of something going on which is a little bit odd. Joint laxity is an interesting one. And so I'm sure that you guys have seen a lot of foals that have some degree of laxity through the hock or the fetlock or the carpi, where it predisposes to an angular limb deformity. I'll just turn the volume off. You can see that this little foal had bilateral front end carpal contracture with laxity behind. And if I pause it at a good level, oh, sorry, it's not going to do it. Just here is if we're standing behind this foal, you can see that the bones of that right hind leg are not straight. Now, the reason for this is because the periarticular structures are not strong enough to hold that joint with good stability and rigidity. And so as that foal is bearing weight, you get some deviation of that leg. Now, if the foal is born normal and then it develops an angular limb deformity later on in life, we are to say that that foal has what is...
Hey, come here. I can't hear without you doing that. Come here.
We're to say that that foal would have an acquired angular limb deformity. And there are a number of reasons or factors that could cause that, from dietary imbalances, trauma and lameness. I think that they probably go hand in hand to some degree, but you can have separate cases. And so, i.e., right, as a foal is growing, it is relying on symmetrical growth of that growth plate to some degree. Now, if for whatever reason it undergoes some degree of trauma, it can damage those cells that are important for turning cartilage into bone and growth. And so it may have uneven growth across that growth plate, causing an angular limb deformity. Now, lameness is an important one. And the reason why lameness can cause an angular limb deformity is if a foal is lame, let's say in its left front leg. Now, the way that it's going to adapt to that lameness is to take a lot more weight onto its right front leg. And it's actually the opposing or the contralateral leg that is the one that normally experiences an angular limb deformity because of the increased weight going through that leg. And then there is some degree of genetics involved. Now, regardless of the cause, you're ultimately getting disproportionate bone growth, which is leading to the development of an angular limb deformity. And so I won't go into this picture too much. It was just to remind me that the growth plate is important for symmetrical growth, and a compromise to the cells or the growth plate can lead to an angular limb deformity. And so, right, so you've assessed the foal, you've seen that it has an angular limb deformity. So then what, right? What does that actually mean? Well, we have two options, really, basically. We're either conservative in our management or we undertake surgical management. And so when we think about conservative management to an angular limb deformity in a foal, there are a few things which are important. Confinement and controlled exercise is really important. And so if we have a foal that has an angular limb deformity that, let's say, is of moderate severity, so it's easily recognizable, and we let that foal go out in a big pasture or a big paddock, the problem with that is that increased exercise through an already abnormal deviation or deviation tends to make it worse. And so one way that we can try and treat angular limb deformities from early on is to have some degree of confinement or controlled exercise. Now, certainly that would be a case-by-case basis. It would be dependent on where it is. It would be dependent on the severity of it, as well as other factors as well. And then foot manipulation is really important. We know that foals with angular limb deformities, they wear their feet abnormally. And so trying to maintain appropriate hoof balance is crucial in these foals. And that needs to be implemented as early as possible to some degree and consistently as well. And then diet modification. So diet modification kind of revolves around maybe restricting caloric intake for a period of time to reduce excessive weight gain, because we know that during rapid growth periods, it can actually exacerbate the angular limb deformity. And so foot manipulation. So we have two ways to kind of go about this. We can trim the foot and we can apply hoof extensions. And so trimming. So for a valgus deviation of the fetlock, what tends to happen is as that foal is walking, right, a valgus deviation is where everything is going lateral below the joint, is that it tends to wear the inside of its foot naturally. And so the way that we want to help that foal is to actually trim the outside of its foot to maintain as appropriate hoof balance as possible. And then with a varus deformity, i.e. that foal is pigeon-toed, you can imagine that as it's pigeon-toed, it's going to wear the outside of its foot naturally. And so one way that we want to help with balance is to trim the inside. And then hoof extensions can also be very, very useful. So if we have a valgus deformity where that foot is turned out, essentially, we can put an extension on the inside of that foot to stop that foal wearing the inside of that hoof so much. And it's the opposite for a varus deviation, where if you have pigeon-toed, it's going to be wearing the outside, and it's going to roll or break over on the outside of its feet. Is that by placing an extension on that area, it kind of protects it against that abnormal breakover, and it can help realign a more normal position. And so here are some pictures of that, right? So the image on the left is of a carpal valgus deviation bilateral, and you can see that that foal is going to want to wear that inside of that right front and also that inside of that left front. And so one way that we can try and help that is to place an extension on the inside to stop that foal from wearing so much on its inside. And then if we have a fetlock varus, the image on the right shows that if we have a fetlock varus, i.e. it's pigeon-toed, it's going to want to wear that outside of that foot. We can put a lateral extension on to help support that foal. Now, there are a couple of ways to put an extension on a foot. The top left image shows a type of glue that we can use to model to the foot, and we can make that level with the solar surface. We can make the extension as big or as little as we want. One thing about using the Equilocks is that it gives off heat as part of the reaction as it's setting. And so you have to be quite careful that when you put that glue on, you don't burn that foal's foot. And it does happen on occasion, and it can be very, very painful. So it's something that needs to be done by someone who's relatively experienced at it to try and prevent any complications from that. And then another way that we can manipulate the hoof through extensions is through what is called a Delric shoe, which is this bottom left. And it's nice. It's like a little cuff. They come in different sizes, and you can fit that to the size of that foal's foot. And then you can bring the outs or the extension part in a little bit. You can move it out a little bit. And then you secure that foot to the extension with a little bit of glue, and then you can tape that on the foal's foot. I guess one important point is that foal's feet, they're not super strong, and you have to be quite careful about putting extensions on that strain the hoof capsule and the attachments of the hoof capsule to the bone. I would strongly recommend that feet trimming and hoof extensions are done by someone who does them regularly and is experienced at them, because you can get complications that can make things a lot worse. But nonetheless, used in the right circumstance, they can be very effective at supporting hoof balance for various types of angular limb deviations. And so if conservative management isn't working or it fails, and we get to the point where we go, okay, what options are we left with? We get to surgical intervention. And I'm not going to say that it's necessarily the best intervention, even though I'm a surgeon, but it is something that we offer and should be discussed in relation to the treatment of angular limb deviations. And so really simply, when we think about surgical intervention, we can think about it in one of two ways. We either try and speed up growth or we try and slow down growth. Now, this image on the right is a moderate bilateral carpal valgus, i.e. the bone distal to the carpus is going lateral. And so if we're to zoom in on one of those knees, you can see that one side of the bone above the carpus is longer than the other side. And so pretty much one side is growing too quick. And so if we're to speed up growth, we want to speed up growth on the side that is not growing fast enough. And if we want to slow down growth, we want to slow down growth on the side that is growing too quickly. And so for this particular case, you can see that the inside is growing too fast. We would want to slow that side down. And if we wanted to speed up growth, we would try and speed up the growth on the outside. And so periosteal stripping is one surgical intervention. It's probably one of the oldest types of surgical interventions. And the reason for performing a periosteal strip or a periosteal elevation is to try and speed up growth on that side of the leg. Now, the way that we do it here is slightly different to what is described in the textbooks, and I'm going to talk exactly how it's different. The way that we do it is through some stab incisions on the side of the cannon bone that is not growing fast enough. And then essentially what we're doing is we're putting what's called a periosteal elevator through each one of these stab incisions, and we're lifting the periosteum off the bone, and we connect it between those stab incisions. The good thing about doing it like that is you don't need a suture or anything, and they're relatively small incisions, so the skin generally heals quite well. Now, whether or not this is effective, some people think that it's not effective. Some cases you might get a positive response out of it, and different surgeons have different opinions about it. I guess the one thing that's important to say about this type of surgical intervention is that you almost always get some degree of periosteal reaction. So what that means is you might get a little bit of thickening around the area where you're lifting that periosteum off the bone. And I think that that's important to consider, particularly if the way that it looks after surgery is important. It might not be the best option. One of the most common surgical techniques that we use is called a transverseal screw. Now, this technique is in contrast to a periosteal strip, because what we're trying to do here is we're trying to slow down growth. We're trying to slow down growth by putting a screw across the growth plate to restrict that side and allow the other side to catch up. Now, it's a pretty straightforward technique, has a very low incidence of complication. You get good healing post-surgery, and it's a relatively short procedure. And so we believe pretty strongly that a transverseal screw is more effective than a periosteal elevation, and you get better cosmesis as well. The image up the top left shows a screw which has been placed from just above the growth plate. It goes across the growth plate on the side that is growing too quickly. There are a couple of important factors with this type of surgery. The screw doesn't need to be too long, and it needs to stay on the side of the growth plate that is experiencing growth that is too quick, because that's the side that we want to slow down. Now, here at Avenel, we put these in under anesthesia. There are some places around the world that will do these standing. We feel that you get a better screw placement with the foal undergoing a brief anesthesia. You can take x-rays. It's very safe. Foals are generally very healthy. It's an elective type of surgery a lot of the time, and foals generally have a very good recovery. So it's our technique of choice for slowing down growth on the side of the growth plate that is growing too quickly. And then we have a transfascial bridge. A transfascial bridge is really restricted to carpal angular limb deformities. And there are a couple of reasons for that. I'm going to talk through these x-rays and explain what's actually going on. So the x-ray on the far left, you can see that there's two screws. We have one screw which is below the growth plate, and we have one screw which is above the growth plate. Now, these screws are connected to each other by wire, and what they're doing essentially is they're creating a bridge across the growth plate on the side that is growing too quickly. And so it serves the same function as putting a screw across the growth plate. But the reason why we do it this way in foals is because we don't want to interact with the cells across the physis too much. Now, I just said before that for a fetlock, we'd like to put a screw across the growth plate. We don't tend to see complications with that, but with carpal angular limb deformities in young foals, we know that if we put a screw directly across the growth plate, we can get premature closure of that growth plate. And so we don't want to do that. We tend to stay away from that. The x-ray in the middle shows the way that we do it here at Avenel. Again, you can see that there's a screw just below the growth plate. Here, there's a screw just above the growth plate. Instead of using wires, we have a pre-made little plate that we use. And the reason why we use that is because then we don't have any sharp points from a wire directly under the skin. It's very easy to place. We get very good healing, and it seems to be a really good technique. And then the x-ray on the far right shows a screw directly across the growth plate. But the important thing is that that x-ray is taken from a much older horse, where if you get closure of the growth plate, it doesn't matter so much. But closure of the growth plate in a young foal can cause major complications. So we're going to come back to this little foal. This was a foal in Colorado that had moderate bilateral carpal valgus deviations. Ideally, they shouldn't get to this point in foals, but so this owner was kind of a little bit new to the game. The foal was a little quarter horse, so it looked like it was on steroids at a very young age and was growing at an outrageous rate. And so it had a mild carpal angular limb deviation, was allowed to run around in pasture, and was putting weight on at a very high level. And then it develops this moderate carpal angular limb deviation. And so the way that we treated that was to put a screw above and below the growth plate and create a transfascial bridge on the inside of the leg to slow down growth on the inside. The x-ray on the right also shows that there are some changes to the bone around the growth plate, which is not abnormal in these types of cases because that bone is under so much strain on the inside of the leg. Now, I put these in because sometimes you get complications, and we got a mild complication in this particular case. As you can see the image on the left, the way that that foal is standing, pretty much it was hitting the inside of its knees against each other. And so it irritated the implants over the carpus. You can see the image in the middle, and then the image on the right shows some degree of discharge from that area. This doesn't happen unless the deviations are pretty moderate to marked. And it normally doesn't happen because we restrict these foals to stall rest, but the owner didn't want to do that. So it got a surgical site infection around it. We managed it because we knew that if we didn't fix the angular limb deviations, the foal was going to have no chance at life pretty much. And so we treated the surgical site infection, and then gradually this foal got better. And the image on the left, it still shows that it has a bilateral carpal angular limb deviation. And then the image on the right is pretty much the final product. And that's pretty good. It took a while, and it was a lot of work doing education and going out and seeing this foal and assessing it. But the final product was well worth it. And, it's great. That's why we do what we do. So what factors are likely to influence your decision? Well, there are a few factors which are likely to play a role in whether or not you need to do anything, whether or not you're conservative, and whether or not you undergo surgery. So the age of the foal is really important. The underlying cause is also really important. Location, the severity, how much the foal is worth, and whether or not it's actually cost efficient to undergo surgery. And then also weight and weight gains. How quickly is that foal putting on weight, and how quickly has it put on weight? So age of the foal is important because you've got to remember what we're trying to actually achieve, and what you guys are trying to achieve is that foals are born very narrow chested. They lock their elbows into their side to support themselves. But we're ultimately trying to produce something that goes from this to something that goes to that. And so the important thing about that is that a foal is very rarely born with straight legs. Most of the time, it will have some degree of valgus deviation through the carpi, i.e. the legs are maybe pointed out just a little bit. Now, as that chest is really narrow, as that foal is going to grow and develop, the chest will expand, the elbows will come around a little bit, and those legs, when they were originally pointing out just a little bit, will come back in. And so that's perfectly normal. That's the way that a foal will normally develop. And so having an understanding of what a foal should look like when it's born, what is acceptable, and then how it's going to progress over the first few months of life can be really important in helping to determine whether or not any treatments need to be implemented for the management of that case. But the age of the foal is also important because we only have certain periods that we can complete surgery, because the whole point of surgery is to take advantage of growth across the growth plate, but the growth plate is only active to a certain degree of time. And so we like to think about for fetlock angular limb deformities, you really need to have an idea as to whether or not you're going to do surgery by approximately 2 months of age. Now, you can do surgery a little bit after that, but the efficacy of the surgery, or the effect of the surgery, is likely to be less as that foal goes over 2 months of age. Now, I guess the other important thing is that sometimes we'll get foals that are a little bit older than that still have growth plates which are quite open, and we can always take an x-ray to check. But it is important that if you're going to do surgery on a fetlock, that you have some idea by 2 to 3 months of age. The carpus is a little more forgiving. The growth plate associated with the carpus closes much later. And so you have a longer period of time if you're going to do anything, which is unlike the fetlock joint. And then also underlying causes are likely to dictate what you do. So the x-ray on the far left shows almost complete loss of bone. I mean, that's pretty much going to force your hand into either calling it quits or essentially bed babying that foal and hoping that the cartilage can turn into bone. The image in the middle shows that there's a slight spiral deviation, or kind of an abnormal contour to the cannon bone. It's not a typical case at all, and so that might force your hand into acting one way or another. And then the photograph on the far right shows what we call outward rotation. And so if you were to stand in front of that foot, the foot would be in line with the fetlock, and the fetlock would be in line with the carpus, but the whole leg is pretty much rotated out. And so in those particular cases, it can be a lot more difficult to correct that when you have outward rotation, as opposed to an inward or an outward deviation of the bone below the joint that's affected. And then cost and value, all right? So I've just listed, some rough prices for surgery. So when we talk about a fetlock screw, placement of a single screw is approximately 2,200 for one, and then 2,700 for both. The way that we remove the screws that are placed across a fetlock growth plate is standing. So we sedate that foal, we bring it into a clean room, a controlled environment. We'll do a little bit of a local anesthesia block over the screw head, a very small stab incision down to the screw, and we remove that screw. And a lot of the time, you just put a bandage on without any sutures. The carpus, we prefer to take the plates out under a quick anesthesia. And the cost for placing the plate with the 2 screws is listed there, about 2,700 for one and 3,300 for both. And so cost and value does play a role in whether or not surgery is an option. The one thing I will say about placing a screw or screws and a plate is that they tend to heal very well, and you get a good cosmetic outcome and a good aesthetic appearance. That's one really important thing that I think is much better than doing a periosteal strip. So in summary, assessment at birth, I think, is crucial. Having an idea of how that foal is going to progress over the first few months of life, and understanding that a foal is really never born with straight legs. In fact, you probably don't want it to have straight legs from birth. It's going to have some degree of lateral deviation, and as the chest develops and as it grows, it's going to turn in. But if you do identify an angular limb deviation at birth, it's good to know that, because it's important to manage that as the foal develops. Early and consistent intervention. So when we think about trimming feet or having your farrier trim feet, or the need for hoof extensions, it's good to be consistent in that approach and maintain the best hoof balance possible, and manipulate the feet to try and counter what that angular limb deviation is doing. Recognizing windows for various treatments is also important. We have seen a few horses where they have had angular limb deviations, but they've just got out a little bit too long to help it not as much as we could have if it was a little bit younger. So recognizing that if surgery is needed, there are certain windows that you have to get the best possible outcome. And then the last thing is that if you have any questions, or you want to send a photo or an email or something like that, and just get an opinion on something, or want a second set of eyes, we're always more than welcome to form new relationships and give our opinion on things. And that's it's something that obviously we don't charge for. It's just part of what we do in the veterinary profession. And that's all I have. So I don't know how long that went for, but if there's any questions or anything that I can make clearer, I would love to do so. It's a big topic and don't have a huge amount of time to go through it.
Thank you, Tom. Thank you very much. That's very thorough and informative. We do have a question from Tracy. She asked, in cases such that a quarter of horse fall where there are complications and it took a long time, would there be any compromise to long-term soundness?
No. So in such as a case as a quarter horse where there are complications and it took a long time, no, there shouldn't be. There shouldn't be any long-term effects. The surgical site infections, they're not a problem. You treat those. You really have no option but to leave the implants in and try and get rid of the local infection. And if you can do that and the skin can heal, then you leave those implants in as long as they need to be, and the prognosis is pretty good. Yeah, it is. And those changes that you will see on the x-rays to the bone close to the growth plate, if in that particular case as well, they'll be normal when that foal corrects its angular limb deviation.
Thank you. Any more questions? Tracy just said in cases of incomplete. Oh, sorry, she hasn't finished yet. Tom, I actually have a question. So when when a lot of breeders and owners, when they do bridges or strips, I feel they like those horses are for sale, and like largely is to beautify those horses, if that makes sense.
Yeah.
And say if you just raise your horses to be a racehorse and without worrying about, like the commerciality and all those things, how forgiving would you be with all those like deformities?
Yeah, so it's a good question, and we could go into a whole nother topic here about how do you want and I'm going to call it a finished product to be. So the one thing we know is that horses that have a carpal varus, i.e. the bone below the carpus is pointing inwards a little bit, those horses are predisposed to a higher degree of injury as a racehorse. And so if anything, you don't want to have that as a finished product. Kind of a similar thing for a fetlock as well. You want the fetlock to be as straight as possible. Fetlocks that are turned in or pigeon-toed or have greater than 3 to 4 degrees of valgus, they probably tend not to do as well. Yeah, so you're right, they're mostly for sale. And there is some evidence behind it as well. But in saying that, right, like you look at a horse like Bel which was moderately pigeon-toed, and he could still run faster than quite a lot of other horses that in that time. So there are exceptions, but we do have evidence that there are certain protective factors.
Thank you. We have some more here. Victoria said, thanks. Fabulous talk, Tom. Thank you. Many owners wish to try strips prior to screws to save cost in case of fetlock errors. How long would you wait following periosteal strip and farrier techniques before placing a screw?
Yeah, so there are two questions I can answer.
Sorry, there's one more from Tracy. Sorry.
Yeah, no,
so
that's
the
okay.
owners
I'll answer Tracy's first. So the owner elects to try and get that foal through incomplete ossification, then call it quits. Would it ever be sound? So there are some important things with that. So if you have a foal with incomplete ossification, what it means is that those bones in either the hocks or the carpus are pretty much not there. They're cartilage and they're not yet bone. Or they're bone and they haven't formed completely. And so what it predisposes to is it predisposes to injuries of those bones, crush type injuries. Now, if you sustain crush type injuries to those bones, then the prognosis for an athlete goes way down, and the prognosis is not good at all because those bones are very important for an athlete. So would it ever be sound? Yes, some cases you can if you manage that case appropriately such that it doesn't develop any long-term or permanent injuries to those bones. Now, the question from Vic, many owners wish to try periosteal strips prior to screws to save cost. In a case of fetlock varus, how long would you wait following a periosteal strip and farrier techniques before placing a screw? So it's a good question. Periosteal strips or elevations, they tend to be done much sooner than screws in younger foals. And so to answer your question on how long you would wait, I think it totally depends on the age of the foal that you're doing the periosteal strip on, taking into account the window that you have to try and get good growth if you needed to place a screw. But generally speaking, if you did a periosteal strip on a foal that was a couple of weeks of age, you would implement farrier trimming and or plus or minus extensions, and I would give it a couple of weeks, probably 3 to 4 weeks, depending on age, so long as that if you weren't where you needed to be, you could place a screw across that growth plate. Hopefully that answers your question.
Tracy says, thank you. Yeah, that was fantastic. Thank you so much. Really appreciate it.
Oh, no worries. You're very welcome.
does anyone have any more question? Or you can like unmute to ask a question if that's easier. And if not, I think we'll finish the session. Thank you, guys. Enjoy the rest of your night.
Thanks, Kerry. Thank you, guys.
Thanks, guys. See ya.